Good question. I think that we don't know yet if umbilical blood, cord blood sampling is really worth it or not. There's a lot of studies that are being done, actually a lot in Asia right now, that are trying to figure out if it really lives up to its expectation. So let me talk about very quickly what it is all about. It turns out that when the baby is born, you can actually get stem cells from the umbilical cord. Stem cells are basically cells that can then become blood cells. So for example, let's assume you have a child and then it ends up having a cancer, and conventional treatment with chemotherapy does not work. What do you do then? Well, then what you can do is that you can give the baby or the child extremely high levels of chemotherapy, and by doing that you often can cure the cancer, but the side effect is that you're killing off all of the blood cells in the baby. So you have to replenish that, and the way to do that is that you have to then use stem cells that you then inject like an IV, and then it finds its way to the bone marrow, where it starts living and starts producing red blood cells. So in other words, if you do this, if your baby or your child later on in life has a really bad cancer, you can use it for this purpose. Even more excitingly is another thing that we're doing now when we're doing cord blood banking, is that we can actually get cells from the umbilical cord itself, and those cells are different. Those cells are stem cells that can be used to produce any kind of cell in your body. They can be turned into heart cells, they can be turned into nerve cells, they can be turned into kidney cells. So for example, if let's say you have a very bad liver disease, or let's say you have a very bad kidney disease, or let's assume you're in an accident where your spinal cord is being injured, theoretically, we don't know this yet, but these cells can be used to replenish and produce new organs. Not only that, but these cells you can actually grow. So even if you start with a very low amount, you can get a large amount of them. So the possibilities are endless. The problem, however, though, is that we just don't have the studies to prove that it's really going to work or not. So I think at this point, a couple has to decide, is it worth putting money in for technology that might potentially be amazing? I'm still on the fence. I think people where money is not necessarily a big problem, I say yes. I think for people where the amount of money that you have to pay for this is significant, maybe hold off. I think that the third category, people who have a lot of strange diseases in their family, cancers, things like that, I might push them to do it, because I do think that there's a very high chance that this is going to work. So, hard question to answer. There's no yes or no, but that's sort of the basics behind that. That's a very hard question, and I think we're seeing this a lot also in our American women population. They're trying to decide which is best. If your baby is not too big, then I would recommend that they have a vaginal delivery. And the reason behind that is that there's a lot of benefits in having a vaginal delivery versus a C-section. One of the main things that you benefit from having a vaginal delivery is that you get all of the bacteria from the mother. And it turns out that that will then replenish the intestinal area and form the microbiome, which is the name we call all of the bacteria that we have eventually, 100 trillion of them. Good studies have looked at women who have vaginal delivery versus C-sections, and the babies who are born by C-sections have about a 5-fold increased risk of obesity, diabetes, asthma, immune problems, eczema. So there's a lot of consequences, bad consequences, if you have a cesarean section. So because of that, if the baby's not too big, I would recommend a vaginal birth. The size is very important, however, because one of the negative things with having a vaginal birth is that it will often injure your bladder. So a lot of women, when they get older, will have bladder problems, especially if it's a big baby. So if you're going to have a big baby, even if there's some benefits in having vaginal birth, you might want to consider doing a cesarean section. Now, there's one new way that we're figuring out where we can circumvent some of the problems with not getting the vaginal bacteria from the mother during birth if you're going to have a C-section. And we call that seeding. It's still very new. It's not necessarily recommended, but I think it's very interesting, and I do think that there's a very good chance it's going to become standard of care. So what does that involve? That involves the mother who's going to have a C-section, that she actually uses a Q-tip, gets bacteria from her birth canal, and this is done right before the cesarean section. She keeps it warm, and after the baby is born, she puts it around the mouth and the face of the baby. So by doing that, you're getting the benefits of a C-section in terms of not injuring your bladder, but you're getting all the benefits of a vaginal birth in order to prevent all those bad things that I talked about, you know, the obesity, like getting really fat, having diabetes, immune issues, or so on. I think the safety of a C-section nowadays, if it's done by professional people, is probably about the same as a vaginal delivery. You do bleed more, there's maybe a little bit more risk, but it's not really that much more. I really think it's up to the mother. I think nowadays the safety of an epidural, which is when you get an injection in your back, is actually very, very safe if it's done by a very good doctor, which are really all of them that we work with here. And it allows the woman to completely relax and so on. So my recommendation to my patients is that they should try to do it as long as possible without medicines. Because as soon as you get an epidural, you cannot walk. It affects your ability to walk. And it's very good to be able to walk in the beginning. That allows your hip to open up to allow the baby to come down. So I think the most perfect situation, you come in labor, you walk around a lot, and then when things get really difficult, then start thinking about an epidural. And I think it's okay. It turns out that for most doctors, as long as you have about half an hour left, they're going to give it to you. So in most situations where you're in a private hospital, your private doctors, they will do that for you. There's certain hospitals in America, like the Kaiser system, where it's not really private. They will often cut it off at about 7 to 8 centimeters. But still, in most private hospitals, they will give it to you until the very, very end. So it's not really a problem. Well, that was started about, I would say, about 40, 50 years ago in France. I forget the name of the doctor who started that, but they felt that it was a very natural, comfortable way of doing it. The problem with that, however, is that you just have less control over the delivery. Sometimes the baby gets stuck, and or sometimes the baby has issues with breathing. It just takes away some control. So even if there's some benefits in terms of comfort for the mother, there's a little bit less control during the delivery process. And so because of that, here in America, many doctors are not too excited about it. It is done, however, a lot at home by midwives. And I like to support midwives. I do think that they help a lot. I do think that home births in some situations can be a very nice option. But overall, I do think that there's a little bit less security at home. So most of us who are obstetricians, we don't recommend a home birth, even if we feel that in many cases it might not be a bad idea. We do feel just because it's a little bit safer at the hospital, we still do recommend it to be done at hospital. It's rare to have a bathtub in a hospital. A lot of hospitals do not like to have that there for many different reasons.